Welcome to the River Park Dental Show. This is Dr. Phing Saurer, and I'm here today with the Michael Morris.
Yeah, we haven't had a different guest, so you could just say Michael Morris.
No, but I was trying something different. Did you like that?
I did. That was a nice little intro. But I thought I got excited because I'm like, who's coming on with us? I'm like, oh, it's just us.
It's just you. Yeah. Disappointed.
That's not hurtful or anything. I guess we'll go right to the topic for today.
Wait, can we, before we begin,
yes,
can I say something?
I'd
like to say, yes, happy birthday to Jim Thomas.
Jimmy, happy birthday.
Thank you.
Jim produces about 300 shows every single week, and it is his birthday, so we got to give him a shout.
Yes.
Actually, only about 8 shows.
Whatever, Jim. I was building you up. I was making you look really good. The guy buries the lead. It's fine. 8, whatever. Yeah, that was important. That's good house cleaning. We had to start with that.
Yeah.
All right.
Did.
Nice job, Ping.
Yeah,
only
I
like
remember things.
4 shows in, and you're doing well. That's right. So I think because we only have half an hour to talk, I want to get into our topic right away, which is corporate dentistry versus family owned.
Yeah.
Now, have you had
family owned or private?
I think private makes it sound a little too like frou-frou, like private golf club versus golf club. I think sounds a little snooty.
Okay. But okay.
Do you describe?
Family, I'm thinking of like.
Well, you have a family.
I do have a family, but they don't.
And you treat families.
I do treat families.
So it can be a family-owned. Fine, we'll call it private, but private sounds really.
Most people know it as private practice.
Okay, private practice.
All right, let's move on.
So I think we've established our title. That's what we're talking about. But what I want to talk about is the difference between the two. So for sake of argument, we'll call it private practice versus corporate dentistry. Can you kind of give a background of what corporate dentistry is?
So, with corporate dentistry, I could talk about this forever. But
it's a good thing we got a show.
I know, but in only 30 minutes.
Right. Well, 27 with commercials, but go on. You're wasting time.
No, so corporate dentistry, it's just about turnaround. So they just want as many patients in and out as quickly as possible. They don't care about, and I can't say that they don't, but they're not focused on patient care and comfort.
They're just built more on efficiencies, right?
Yes. It's efficiency. Yeah. Get in, get out as quickly as possible. Do as many things as you can in one appointment as possible. Sometimes I don't think they even offer all the options because it's like they have a limited skill set. So they're just going to do a certain number of things and that's it. So, and then for private practice, it's more patient focused, wanting to build relationships. But unfortunately, I think now a lot of private practices are starting to become more corporate like because they see the revenue and they're like, oh, well, we can do that too. But then they're kind of giving up that personal relationship with patients,
right?
Which I think is sad.
Well, there's a lot of marketing that's out there. These, it's your local dentist, but it happens to be there in every suburb, and the marketing is literally done kind of like a cattle call thing. Get as many people to respond to. It's not whitening. It's sometimes it's just quick, easy. They take your insurance, and we can't unfortunately say the names of these people, but you'll see them. They'll be in strip malls all over the place. They're not. Yeah. Kind of in these little cottage houses, and they're not, the dentist there really doesn't matter to them. It is a corporate environment. Get in, the hygienist sees you, cleans your teeth, kind of moves you down the line like a mill.
Right. No, and you might not see the same people. So if you don't want to see the same hygienist, you just want to go in and get just a cleaning, and you don't care about who you're seeing, what hygienist, what doctor, then yeah, that would work, but I think a lot of people do care. They want continuity of care. They want to see the same people. They want to see the same faces.
How does it work in those corporate environments in terms of if you're not seeing the same faces, your quality of care has got to suffer a little bit. If I went in and I had not a major surgery, but if I had something I wanted followed up on, I would want as a consumer to talk to the same person or to feel like they really cared about what was going on in my mouth.
Because you don't want to keep on repeating your history and what you want and over to a different person.
Speak for yourself. I love to do it.
But, this is not corporate. I work in a dental clinic that's for
people with need, right?
With need. And I run into that, and it's just that I'm jumping into a case. I didn't diagnose it, so I'm going in and doing procedures that maybe I didn't diagnose. And sometimes I might not agree with the diagnosis. So then it's hard because dentistry is not just, there's not one way to do it, but to go in and do
Well, it's
it.
not like working on a car where there's a manual to it and then everything kind of has its pieces and places. Every mouth is different, right?
Every mouth is different, and there's a lot of different options, and yeah, but sometimes you can get to the same place in just different ways. So it's just.
So you're like an artist, is what you're saying? You're trying to say you're not.
Yeah.
Oh, I like it. You're like a tooth artist, a mouth
Tooth,
specialist.
yes.
So have you ever been? I know you do that. That care. It's Fridays, right? You do that care for children that
Yes,
need dentistry.
Kid Smiles.
Yeah, Kid Smiles. Don't you kind of see a similarity between that and the corporate dentistry that's more revenue driven? I mean, it's kind of the same thing. Get them in
Yeah.
the chair, treat them, but you're not really following from inception to the end of their care.
Right.
You're just
There's
passing
no
it along.
follow up. Like, I don't get to follow up the kids that I treat because it's just that day. I'm treating them for that day, and then whoever is next on the list gets to treat them the next time.
Feels like though the part that you're filling in now, donating your time to do that, it feels like that's how corporate dentistry, like
That's
they
how
built
they
a model,
practice.
right? But it seems
Yeah.
like they built a model, like, oh, we could probably make money on this.
Yeah.
And
And I've talked to a lot of patients that have come from corporate offices where they said, I had 20 fillings filled, because they wanted to get it all done in that same sitting so that they can get paid all at once, versus breaking it up to make them more comfortable.
wait a minute, they have actually like diagnosed and said, let's just do this now.
Let's just do all of it right now.
I can put you in this Hyundai.
Yeah.
So, wow, that's.
So they'll do that.
But no one said I walked away because I thought that was an odd thing, because that's not really how it would work in a private
Well,
practice.
some people will, but some people are like, they didn't know that it could be done differently. So they just assumed that that was the way you were supposed to do it, and their comfort may not have been, they didn't care if they were uncomfortable with doing, like sitting in a chair for 2 hours, getting 16 or 20 fillings done. But then a lot of people have come to me and said, they hate that salesy, like, if you don't do this, you're going to lose this tooth. Like, they make it so dramatic and,
Oh, so they couldn't give you that. Like, if
The
you cared
fear.
about your teeth, you'd take
Yeah.
care of it. But you might fall. They might all fall out by the time you get to the parking lot. That kind of thing.
Yeah, they use a little bit of fear. So
You guys should use that though.
no.
Not in every case. Just if you really want to make
Just
some
for
money
you.
that day.
If you come in, I'll use.
That's
fear.
why I'll never come in. I just stay around the front door. I'm not going back by the ops. I know better. Did you ever work in an environment that was kind of like a corporate environment, or you always worked for like a private practice?
Yeah, I worked in a private practice, but then the unfortunate thing is, so once a practice, what I've seen, and not just from my experience, but from other doctors, they get very busy, and then they feel like they need to streamline everything, and they hire these consultants, and like consultants will come in and they'll give
Now you like consultants. I don't mean to cut you off, but you told me how much you enjoy consultants. It's okay to say it. They're probably listening. It's fine.
They're not all bad, but the ones I've come across are not my favorite people.
But you give an example of not so much just what they said to you, but if these consultants are working in these corporate environments, these corporate dental offices, they're kind of giving them a spiel like to go off of, right?
Yeah, so I was given a script and I had to say these specific words every single time, just like a little robot. And of course, I couldn't do it because I'm a person, and and a lot of my patients could tell that I was not being real, like authentic. And I just became very like short in and out and the reason why I even did is because they followed me around with a clipboard, grading me on how I was talking to patients. And I just, at that point, I'm like, I was pretty much done.
How long did you have them kind of following you around with the clipboard?
It was the beginning of the end, so probably around 6 months before I started making my exit strategy.
Oh, this wasn't when you opened your place. This is when you were at the other.
Yeah, at my
working
old
for
office.
someone else.
Yeah, so I left.
And so now you have your own practice, or
Yes.
have had your own practice. Would you ever do that again? Would you ever have the consultant come in?
No. I think they overcomplicate things. It's not that hard. I think if you just treat people the way you want to be treated, be kind, listen, then you should be fine. You don't need to be told how to talk to people.
But they're not telling you how to treat people. They're telling you how to generate revenue, essentially. Right? Those consultants, I mean, they're job is not so much just patient care. It is how does this facility make more money? Isn't that why they're hired?
Yeah. How do you make more money? But how do you make more money is by diagnosing more, doing more work, doing a lot more work that maybe I don't think is necessary, but you're just trying to find something. So there was that mentality. You always have to find something to do. And I'm like, well, what if they don't have anything to do? What if they're,
Got to be closing, Phing. Always be closing, ABC. You got to find something wrong.
But I don't, everyone is in charge of their mouth. So they can come in when they're ready to do things. And of course I'll treat them if they want to do it. But I'm not going to keep looking for things and selling it. That's just not, I'd rather just, if they have an issue, I'll point it out. I'll educate them about it. And then they can decide if they want to do something about it.
Have you, I know that you know people in this field, but I think I've told you stories off the air where if a dentist was coming up short for the month, all of a sudden they just happened to find 4 or 5 cavities in each person that was in their chair.
Yeah, I've seen that.
I mean, you've heard that. You've heard of people diagnosing, and the patients really, it's up to them to say no. But at that point, this is a healthcare provider telling you,
right? There's
you need
trust,
this.
and
right.
it actually makes me upset because that's someone that's in my profession, and they are having a patient mistrust. So then when they come and see me, they doubt it too. They're like, "Do I really have a cavity?" And it's like, and I have to just show them, like, "Yeah, here it is on the X-ray and stuff." But still, they weren't trained to read X-rays, so it's not like they're still taking my.
That was my favorite, is when they're like, "Here's your X-ray," and they put it in front of you, and the entire time I'm go, "Yep, that's what I thought it would look like." I have no idea what I'm looking at, but I just want to feel like I know something. I never understood that. Like, do you want this done? Listen, I know. Let's do it. I mean, it looks good to me. What does that mean?
I don't know. I mean, well, so maybe not X-rays, but pictures. Do pictures help?
No, because I'm not in the medical field. So when I look at this, I just go.
But you can tell if I show you a picture of a tooth that's broken, you can tell that it's broken.
Okay, sure. But do I want to see if it's in my mouth? No. Just, you could tell me. I'm speaking for me, not America. I'm just saying
for all of America,
for the populace. If something's wrong and you know that it's wrong, fix it.
Yeah.
My only concern is where I've heard stories where someone there's nothing really been wrong, but I'm still going to diagnose it. And I feel a lot of that comes from that corporate background. It seems more private practice people are hearing how much money they can make from going to these conferences and hiring these outside firms. That's what I hear more of today.
No, definitely. And what they tell you is they'll give you percentages. Like, you should have this many crowns per month, or this many patients that need perio scaling root planing, or this many. And these numbers and percentages start to get in your head, and you're like, oh, like, I'm not meeting that. So should I be doing more? And then I don't know if it's that pressure to do that. I don't listen to those numbers, though. It's just, if I see something, I will diagnose it, and then I will treat it when the patient's ready to be treated.
But I think it's good that you have the experience where you actually went through that somewhere else, and then having your own practice, you know what you wouldn't do.
Right.
It just seems to me that my concern as a patient always, when it came to dental or anything else, was, what are you trying to push on me as the consumer? Because I'm always thinking of dollars and cents. There's got to be a reason. Like, if it is something I definitely need, I got it. I understand that.
Yeah.
It was more, well, we found this. It wasn't, this needs to be treated because of this. It's, we found this. And again, it goes back to that old car dealer thing. We rotated your tires and found out your brakes, they're just a little bit messed up. So we could do that, and it's only $800.
Oh,
I mean,
gosh.
it's up there on the rack.
My car. Yes. Every time I go get my car,
I feel like you fall for that one a lot.
I say
your
yes to all of it.
windshield wiper fluid is low, so we're going to charge you $1,600.
I don't know how to fix it, so yes.
But don't you feel that's the same way people look at a dental office? They don't really know.
Right.
Like, you can't go home and fix it yourself.
No,
I've tried. You can't. Just pointing that out.
What are you using?
Just mainly coffee and prayers. Just kidding. Mud. Yeah, just cake it in there.
It's organic.
We're all green at my household. It's all recyclable and green. It's fine. I think we should take a break here, but when we come back, I still want you to get in. I want to delve into the corporate dentistry versus private practice, as you say, and kind of differentiate, because we've talked about what corporate does a little bit, and we've said almost nothing good about it. So I want to talk about the good about private practice. You're going to say something.
No, I don't want to say it's all bad because I have some friends that work in corporate dentistry and they have ethics and they have morals, but.
Because they're your friends?
No, I mean, yeah, I only have, my friends are all very ethical.
I think you're saying that because they're listening on Facebook right now.
No, but I will say that like it's when you're under that pressure and you have a family to support, you have all this school debt and loans and stuff. Right now, the term is like corporate dentistry likes to put new grads, people that just graduated with $400,000 in debt in gold handcuffs. They dangle a lot of money in front of them, but what they don't tell them is that you have to produce and do all these crowns, all this stuff to make this money. And, I think the pressure can get to you sometimes if you feel like you have a lot of debt and you have a family to take care of.
I totally get that. So basically you just described corporate dentistry as a ransom. I think that's a good place to stop, and we're going to take a break. You're listening to the River Park Dental Show. We'll be right back.
Do you dread going to the dentist because you hate getting shots? I'm Dr. Phing Saurer, and I'm excited to share a needle-free solution with you at River Park Dental. I use the Celea laser, the latest advancement in the dental field, to perform many procedures. No needles, no drill, and no more fear. Come see me and my team at River Park Dental. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
I'm Dr. Buzz, DC, with Buckeye Physical Medicine and Rehab, Columbus's largest hormone replacement center. For the cost of a cup of coffee a day, you can completely reverse the effects of aging and the aches and pains of low T. Thousands of patients that suffer from low T have come to us to rejuvenate their youth. Buckeye Physical Medicine patients have enhanced their energy levels, rid themselves of inflammation, and feel years younger. Call Buckeye Physical Medicine and Rehab at 614-721-5698. That's 614-721-LOW-T. Or visit BuckeyePMR.com today.
When distracted drivers cause injuries or death, they hide behind their insurance companies and lawyers. Who's there to protect you? Get Scott Smith. Get justice. Call 888-311-LAWS or sestriallaw.com. Get Scott Smith. Get justice.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you are told to see a different dentist with a different set of financial policies at an inconvenient location? At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
HouseTrends.com, the perfect place for you if you enjoy looking at beautiful homes and outdoor living spaces. Their stunning photos and articles focus on local Central Ohio residential building and remodeling projects with plenty of kitchen, bedroom, interior design, and landscaping ideas. You'll also discover exciting options in home design and furnishings. HouseTrends.com adds new content daily. Sign up to receive their online edition and check out past issues too. Go to HouseTrends.com and click on Columbus.
Hi, this is Jeff with Myers Jewelers. If you're in the market for an engagement ring and or wedding band, then let Myers Jewelers be your one-stop destination for this bridal season. At Myers Jewelers, we have teamed with some of the finest designers in the world. From Tacori to Hearts on Fire to Martin Flyer to Simon G, Sylvie, and many, many more. Along with our great selection of designer ring styles, we have a multi-million-dollar selection of certified loose diamonds as well. Come visit the family on Stringtown Road in Grove City and experience Myers Jewelers.
Hi, I'm Dr. Phing Saurer, owner of River Park Dental. My team and I provide tongue and lip tie releases with a CO2 laser for babies struggling to nurse. We understand how stressful this can be. To make it easier for you, we bill our fee to most medical insurances. That way you can focus your time on what's important, you and your baby. We are proud to be your local provider. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Are you an outdoor person? Do you want to do creative work? Check out the job opportunities at Greenscapes Landscape Company. We are now hiring for our new Northwest location near Dublin. No experience necessary, just a great attitude. We offer great pay, health insurance, and a company matching 401k plan. Go to greenscapes.net for an online application or call Sandy at 614-837-1869. Greenscapes is an equal opportunity employer.
Welcome back to the River Park Dental Show. This is Dr. Phing Saurer.
Ping, I cut you off before the break. Hold on one second. You good? Okay, good.
There's some coughing going on.
There's some light hacking. going on while we're doing the show.
Very
so
concerned.
We talked about corporate dentistry, and I don't want to say we bashed it. We just kind of discussed the quality of care is not so high.
No.
Right? As far as a private practice. So can you talk about what a private practice really does, like what you see on a day-to-day basis? Because we describe basically like a mill operation. Get them in the chair, diagnose, try to hit these numbers.
Yeah.
You don't have that in your practice.
So, I mean, I have to run a business, so you do have to look at numbers to an extent. However, like I am also treating the patient and their families, and I care about them. I want to know about their lives and like what's going on with them, and I do.
I know you do.
I like it though. The one thing I do miss about my patients from my previous practice is that I watched a lot of them grow up, from middle school to high school to going to college and getting married. So it's that progression that I get to see with their lives. That's fun for me to see. So I enjoy every single month, like every 6 months, seeing them and getting an update on what's going on in their lives. So I think that's really cool. But besides just the patient care and getting to know the patients, I have more control over the technology and what kind of materials I'm using. It's cheap is not always the best, obviously, but for corporate dentistry,
where is cheap ever the best? Like in tacos?
But everyone looks. I always want to buy the best product, So I will only get technology or products that I would even put in my own mouth or treat my family with. I wouldn't get anything that's subpar just because it's cheap or less expensive or anything like that. So that's really important to me. Well, we talked about technology a little bit. It's just it is expensive and it is an investment, but I'm willing to put that investment in because it does make my patients more comfortable and it's more convenient.
Is that part of your golden handcuffs though? Your own that you're putting on?
I have handcuffs. I have handcuffed myself. It is very true.
Yeah, but again, it is your own debt to your own business, but you're investing in your business.
I'm investing in my business. Right.
We have touched on the technology of, the Celea laser is something, didn't you just go to some conference?
Yes.
And because I feel like you text me, I don't know, 300 to 400 times to talk about the Celea laser. And I think it's an important thing to talk about.
It's a really cool laser.
Right, but I knew you were going to go there. But we'll get into it.
Do you want me to get into the laser physics?
Can you? No, not yet. I want to finish this thought.
Okay, sorry.
You said that, what is it, less than 2% of all dental offices have
less than 1.
All right, well, I'm not perfect.
Even...
So less than 1. So if that's the case in the corporate level, they probably don't have that. You're one of the few that does.
Yeah.
So I thought it would be a nice way to say like a private practice probably has more options in the technology they can use, but you're still on the forefront of technology. Now is where you can talk about that laser. No, you can do it now into the radio, right into the microphone. Yeah.
Yeah, this laser is really neat because it's, laser is basically a light, and the wavelength for this specific laser actually gets absorbed by hydroxyapatite, which makes up the majority of a tooth.
Sure.
It's very exciting.
Show me on an X-ray.
So when it absorbs that light, it basically dissolves that tooth, and that's how that tooth you are able to do fillings and stuff like that. And what's cool is it also has an analgesic effect, so that's why you don't need anesthetic, because with that the laser, it just kind of getting into more of the too much detail, but
no, it's fine. Keep going. People love details.
They love all the physics and
lasers.
Stuff with it.
People love lasers.
So anyway, it has an analgesic effect, and it just evaporates the tooth, and it's awesome, and you don't have to get a needle, and it's great.
But again, this is something that you could make a choice on, and versus a corporate, you have what you have, right? Somebody's making it. Someone is in the purchasing or buying position, and they're saying this is what.
Well, it's not just purchasing; it's the training. There's a lot of training that goes with it, and traveling with it, and they don't want to invest in that, because it.
Would it be fair to say they probably don't invest in their people either? Like you have your continuing ed courses that everyone has to take, but
a lot.
But they're not going to. That's probably more of that. We're going to train you as a younger person in the business, and then eventually, if you want to branch out and do your own thing, you can, because that's the only way to really make money, right? Is to work for yourself. So you have to break out at some point, but they're not going to put a lot of training or education
No.
It's just your continuing ed that you have to do on your own anyway to keep your license.
Yeah, and the hours that we have to actually have aren't that much. Me personally, I'm always motivated to learn more.
Well, you are a doctor. We've covered that on previous shows. You have 2 doctorates.
Yeah, I'm gonna try to get another one. We'll see.
Overachiever.
No.
Keep going. So the continuing ed piece is the part that I know everyone has to keep going, but you are like...
I love it. I'm traveling probably once a month.
Right, but you were texting me from a conference, weren't you? That you were learning more about this laser?
Yes, I know. I probably was annoying you because I was so excited.
No, I loved hearing more about this laser. But I mean, that's the key to this, right? Is to continue getting better, to continue having more knowledge about it. So that's kind of where you're at in your practice. And your practice is newer, but not just in terms of how long it's been around, but the technology that you're embracing.
Right. I mean, dentistry is always evolving. So like you can always use the tried and true, which they still work perfectly fine, but there's always going to be a better way to do things. And the research is out there and it's going to keep coming out. So I think you have to keep up. That's what people want.
Does have to do one of the things that Ellen shared with me. And Ellen, if you call the office,
Ellen.
That smiling face will probably pick up the phone. She wanted me to touch on the professional freedom that you have in your environment when you have a private practice. What does that entail for you?
I mean, the thing is, I don't have anyone following me around with a clipboard telling me I'm using the wrong words. Ellen does. Yeah, she
Ellen
does.
follows you around, but with a phone.
So I get to do dentistry the way I want. And it's not selling dentistry. It's just educating patients and doing a good job and treating people like they're people. It's not as complicated as a lot of these consultants try to make it. With the fear and all this stuff. It's just, I think people want to have dentistry is very intimate. Like I'm probably 6 inches away from your face.
Which is about 8 inches too close.
But it's true. So like when someone's that close to you, you want to feel comfortable around them and you want to have a relationship. And so that's what I get to do. I get to do that kind of dentistry.
Well, you really had to trust that person. Again, not just with your health, but like you really have to want to let them that close to you.
Right. And I have small hands.
Yeah,
I just want to point out.
I would like to buy you some large gloves.
Smells like cabbage.
Yeah. It's a very odd thing to see, especially when you're sniffing them on the radio. If you could just summarize, like we're almost out of time, what would be your summation of corporate versus private practice? And it doesn't have to be a poem, but I'd like to, if you had to compare the two, how would you break those out?
If you don't care who you see and you just want quick and fast dentistry that may or may not be the best thing for you or the best solution, then corporate dentistry is for you.
That was so flattering the way you did that. Okay, so private practice, how would you break that out?
Now, if you want to have a relationship with people and see the same faces again, and know that you can trust, and this is, I hate making such
no, I like when you do
statements.
I like when you do this
because not every private practice dentist is great either. So and not every corporate dentist is bad.
Could you give a website of a private dentist that you would trust?
Mine.
Oh, yeah, do that.
riverparkdental.com.
All right. And now if someone wanted to call you because they wanted to trust you, what would that phone number be?
614-689-8686. And the beautiful Ellen will answer with some giggles.
With a big smile. Well, with giggles, maybe. That's all we have time for this week, Phing. Fantastic job. And next week we will not talk about...
How do you say my name? Phing.
Phing. Phing. Do you have anything else you'd like to leave people with other than that I said your name improperly? Apparently?
No. It's always good to be here, Mike.
Yes.
I'll see you next week.
Unfortunately, you will. That's it for the River Park Dental Show.
You've been listening to a Morris Media production.